minorities or not.
Thank you so much. I yield.
Thank you, Dr. Alison Brooks. Very good sneaking that last comment in. You know what I'm saying? After the buzzer. Senator Husted.
Thank you, Chairman Cassidy, Dr. Bhattacharya. Thanks for being here. Although, as someone who grew up watching professional basketball in the 70s and 80s, calling you Dr. J is a fun thing, too.
It's a real thrill for me whenever I hear that.
Thanks for your nomination, frankly, at this time in America is a victory for the scientific method. I know that you have been courageous in offering divergent views and backing them up and encouraging people to think differently about how we solve complex problems. That's what science is supposed to be about, so thank you for being a champion of that during difficult circumstances. I want to just talk briefly about something we talked about is that we heard a lot of talk about inflation in America, but in this century, the number one inflationary cost that affects Americans, American business, the quality of life has been healthcare inflation. And the idea that we can think differently about how we address healthy living, our diets, how we improve the quality of life, drive down costs, and improve outcomes is something I think is sorely missing today in the conversation about healthcare, and thinking differently about it is critical to doing that. So just give some thoughts about how you think your role as a director could help advance that conversation.
Senator, I really enjoyed our conversation that we had in your office about exactly this. The chronic disease problem, let's just take obesity. It seems almost intractable. For decades, we've had body weight go up, diabetes rates, chronic disease. And in a way, that's an indictment on how the NIH has functioned. The goal of the NIH is to make Americans healthy. It's to have the research that makes Americans healthy. I think I want to make sure that we allow a broadest set of ideas as possible to address this problem, because the set of ideas we've had so far have not actually addressed the problem. It's continued to get worse. Fundamentally, to me, and this is an element of faith, I guess, I believe that if we allow science to have lots of different ideas, that we will be able to meet the health needs of the American people. But if we say, okay, only a few scientists with their ideas are allowed to have support, with the narrowest, like one school of thought, we're not going to make any progress. I don't have the answer to how to solve the obesity crisis. If I did, I would have already would have published it. But I want to make sure that the scientists that's out there has support from the NIH, even if their ideas can contradict what the top scientists of the NIH currently think.
Well, I spoke with Secretary Kennedy, and I know that this goes across agencies from the Department of Agriculture to Health, Human Services, but it is a tremendous cost to the American taxpayer, to the quality of life, to American competitiveness, all of those issues, sustainability of our federal budget. So I just encourage creative thinking and collaboration on that issue. I want to mention lots of conversation these days on NIH grants and talking about containing costs of how we do scientific research, but make sure that we're putting more lead on the target of that research rather than administrative costs. I know that in Ohio we have a number of entities, our universities, Cleveland Clinic, our hospitals, so forth, that are involved in this. I really believe that there are many institutions who are willing to work with you in sharpening their pencils, getting better, forcing change in how these grants are used, distributed, and focused on the research that needs to be done. And just give some thoughts, if you would, about how we can advance those conversations on this topic.
Well, Senator, I think the universities that are partners of the NIH, not opponents. I do think that there's a lot of distrust now coming out of the pandemic of the scientific enterprise and of universities also. The way to address the distrust is transparency, and I'm absolutely committed to working with you and with others to make sure that we can restore that trust by establishing transparency. Where did the administrative costs go? That's a question that could be answered with audits for instance, and establishing the right rates. That's going to, if I'm confirmed, that's something I'll look very carefully into. I think I want to make sure that every single dollar the American taxpayer entrusts the NIH to goes to addressing the needs, the research that will address the health needs of the American people.
Great. Thank you. Thank you, Mr. Chairman.
Thank you, Senator Husted. Now, Senator Markey.
Thank you, Mr. Chairman. Doctor, I've been hearing from researchers in Massachusetts